to our very first virtual tour of the Hough Health Center of Neon. This building was built in 1974 and it has just gone through a very nice renovation, so we're excited to have you with us. Let's go in. Hi, this is the area of convenient care, and I had mentioned convenient care to you before. That allows our hours to be extended into the evening and on the weekends.
Right, I see.
This is our universal testing for COVID-19.
How are you?
And then this is convenient care back here, and we have a physician and our MA. Dr. Kumar is here today, and an MA. And actually my office used to be back there long ago, so. It also used to be a playroom, and we have a little play area outside that the children used to use.
No.
So let's move on into our lobby. This is our pharmacy. Neon has pharmacies at 4 of our health centers, and we offer a very large formulary of prescriptions that are at a greatly reduced rate, as low as $5 per prescription. The Medicaid managed care plans also cover the prescriptions, so our patients have great access to the pharmaceuticals that they need. That's our pharmacists and our pharmacy tech. And this is our hub of the Hough Health Center. This is our business office. And they are crucial in welcoming our patients as they register. They update their demographics, their insurance information. We usually have 2 here, and you can see they have their protection at the window. We also have financial counselors that meet with the patient when they register to see if they are eligible for insurance. If they are, they can help get them in that quickly, especially Medicaid. We have presumptive eligibility, so if the patient looks like they're going to be eligible for Medicaid, we can get them right in and they can be seen. We also have financial counselors that work with the marketplace insurances and can enroll patients in that. And then, if nothing else, we have our sliding fee scale that allows patients to be seen based on their income and family size. This is our laboratory here at the Hough Health Center. All specimens are gathered from our other locations and couriered here to Hough. At one point, we had a full-service laboratory with chemistry, hematology, and other services, but that just became so costly that we now use a reference lab, LabCorp, but we do a few tests here. Now we are entering into adult medicine. This area has been completely renovated. Nurses' stations were moved and taken to other areas. So this is our new nurses' station. Very beautiful. This is one of our nurses. And this is adult medicine.
Hi.
These are the case first-year medical students who are going to be watching us remotely, so they can't come because of the virus. So This is adult medicine. This is where we see 21 and up.
Yes.
Yes, 21 and older. We have 3 physicians and 1 family nurse practitioner in this department.
And we have a foot doctor.
Yes, and the podiatrist as well. Right. Introduce you now to Pamela Gray. She is our Director of HIMSS, Health Information Management and Population Health. Here's Ms. Gray.
Hi, it's a pleasure to be able to speak to you all. So as was mentioned, I am Director for Population Health, and one of the things that I'm most proud of is a tool that our providers have access to, and that is Eagle Dream, a population health analytics tool that really allows them to manage their patient population, to identify gaps in care easily and try to close those gaps before the patient even arrives. So we've been finding that this tool has really enhanced our ability to reach patients, in many ways to alert them to missing gaps as well as recommendations that they're missing. And so hopefully in the future, we'll be able to show students what that product looks like.
Thank you.
Here we are in pediatrics. This is another area of the health center that has been completely renovated. Another new nurses station, beautiful blue. You see we have a little play area, but unfortunately because of the virus we had to put all the toys away. So this is our nurses station for pediatrics. One of the nurses. Yes, we actually have one of our family physicians is working here during the relocation with the virus, so he's also here as well. So
He was looking for you.
really,
He wanted to say something.
they're always looking for me.
So you pass by.
Yes, I'll find him later. So this is Peds, nice open, pretty, and nice little play area when we can bring the toys back. We also do Reach Out and Read, which is the reading program for children. The provider recommends a book for every child that comes in for the parent to read out loud to the child. And again, we had to put a lot of that away, so, but it'll be back. All right, let's go to Kathy Boysaw, our care coordinator. And I think you have to let us in. Thank you. Here's an exam room. That's not really a typical exam room, but I was going to say we can see an exam room. That's an office. I'll cut that out. Let's see if she's available. Okay, this is Kathy Boysaw, our managed care case manager.
Hi.
Hi.
We met yesterday. Oh, we're filming. Hi.
Hi. These are all of the CASE first year medical school students, class of 2024. This is Kathy Boysaw, our care coordinator, and she's going to tell you a little bit
Come on
about
in.
what she does in the blue room.
The blue room, come on
The
in.
blue office.
Social distancing and making sure we take care of that. My role here at Neon is to make sure that all of the patients that have a chronic condition such as hypertension or diabetes, to make sure that they have not only their medical needs met, but also needs that may impact their socioeconomic situations, such as job loss, dealing with a death in the family. Maybe they may need to connect with our behavioral health specialists. Just some of the maybe non-traditional things that you would maybe not associate with case management is what I do. And I'm the person that chases for the providers, patients who may be having a problem maintaining their good numbers and complying with prescribed things that the doctors may have indicated for them. So I'm the person that does the chasing. Okay. Nice meeting you. Bye-bye.
I wanted to show you a typical exam room. Well, this isn't quite typical, but this is one of our pediatric exam rooms. But unfortunately, our dinosaur must be in the dinosaur doghouse because his nose is in the corner. But I always thought this was such a great exam room for kids. So, I'd like to introduce you next to Sheila Sullivan. She is our adolescent specialist, but otherwise known as the condom lady.
Okay. Hi, I'm Sheila Sullivan. I run the app program. My job is to help adolescents, 13 to actually 24, understand reproductive health and the risks they take when having unprotected sex of any kind so that they can make good decisions. We want them to make good decisions. We want to give them supplies. We want to give them information. And we want them to understand how their bodies actually work. So sexual health is not just about sex. Sexual health is about long-range reproductive productivity and longevity. We need them to understand that everything they do today affects their tomorrow.
And who do you see?
I see every adolescent who walks through Hough's door in the pediatrics department 13 until 21 and 364 days.
Thank you.
Thank you.
I'd like to introduce you to Annette Turner. She is a licensed social worker in our comprehensive perinatal care department, and she is driven to have healthy outcomes with her patients. Here's Annette.
Hi. So, I really enjoy what I do. Basically, I see every patient that comes in the clinic that needs my assistance. I try to address that need, but my day-to-day responsibility is working with postpartum and pregnant women and their families. So, some of the main goals that I like to try to hit are prenatal care. We want them to come to every prenatal care appointment. We talk about signs of gestational diabetes, signs of preeclampsia, eating healthy, which is very important. Also taking their prenatal supplements every day that help reduce birth defects. And one thing that is really dear to my heart is the SIDS guidelines. So I need you guys to help me with this because we need to reduce infant mortality. Okay, and this is my board here that kind of what we talk about is the ABC of SIDS guidelines, alone, on their back, and in their crib. So we want babies in their own space, not with mommies, no parents, no siblings, in their own space. And we try to help them get a pack and play or a crib. If not, we have the good old baby boxes that they can go online. Now this is old, but this works. And it's just a pillow in there. No, not a pillow, like a little mattress. But no pillows, no blankets, no covers, no stuffed animals, just the baby on their back and one fitted sheet. And that's it, not even bumpers. Even though bumpers are cute, they're not safe, okay? So this is my wall of fame for all of my beautiful babies, that's a great positive birth outcome. That is the goal here at Neon. We want healthy babies, okay? And we are trying to save babies' lives and empower moms and dads.
Thank you.
You're welcome.
Okay, well, we are now down in our Centering Pregnancy Program room, and I have with us today Leslie Carroll. She is the manager or coordinator of the Centering Pregnancy Program and also our Daddy Boot Camp program. So she's going to tell you a little bit about both programs. This is not the normal setup. We usually have a room with the chairs all in a circle for the pregnant women to meet at the same time. But Ms. Carroll's going to tell you what we are working on now.
Yes. Well, to piggyback on what Vicki Marie just said, the room looks like this because it's a response to the COVID-19 with our pregnant moms, because we know to prevent this disease from spreading that we need clean and cleanliness. So our wonderful funders, First Year Cleveland, has made it possible that we were able to buy 40 emergency COVID-19 emergency household kits that we made up to keep the house clean, the moms clean, the family members clean, and the baby clean. And this is what an average kit looks like. We make sure to put diapers, toilet paper, but all the cleaning products are in here. Sponges, mopping broom, they give diapers and everything. Now back to Centering Pregnancy. What Centering Pregnancy is a group prenatal care that the moms, they come in, we have first time moms, we have what we call veteran moms, and they get to bring their support people to come in and be part of their prenatal visit. And it's most important because it helps to reduce preterm labor. We promote breastfeeding. It prevents infant mortality. Usually when these moms are in this program, the incidence of those problems, like low birth weight, are reduced. And usually, like this area is where they sign in, they get nutrition. We teach them how to take their own weight and blood pressure, which is important. Then they go to the nursing station And it's a very social area because the moms are coming in, they get to sit down and have a little nutrition, they get their exams, and then we circle up. And that's what these chairs are for. In this section, we circle up, and these chairs are specially designed for pregnant women, so they're comfortable. And then we get in great discussions about everything about pregnancy, managing stress during pregnancy, oral health, breastfeeding, and we do mindfulness exercises. So that's like the beauty and the importance of Centering Pregnancy Program. I also am program coordinator for Boot Camp for New Dads. And if you could come in, the Boot Camp for New Dads, sponsored by the Fatherhood Initiative, is usually held in this room too. The dads get to sit in the circle and talk about fatherhood. Now what I was gonna show you, those are pack and plays that the dads get, a pack and play for attending a new Boot Camp for New Dads session. Those sessions usually last 2.5 to 3 hours. We have 2 facilitators and their dads. And then we also have a veteran dad comes in and he brings the baby, and the new dads that are sitting in the room get to observe the veteran dad holding the baby, you know, feeding the baby, changing diapers, and you know, things like that. And usually the veteran dad, he gets some incentives. We have veteran dads from the time the baby is born to up to 9 months. Now, due to the COVID-19 response, we're doing Zoom sessions for both Boot Camp for New Dads and Centering Pregnancy Program. Do you have any questions?
Thank you.
We are now in one of our dental operatories, and we have Dr. Bethany Doragazi, one of our newer dentists, and she is actually a Case dental school graduate. She's going to tell you about the dental services that we provide here at Neon.
Hello, I'm Dr. Beth Doragazi, the general dentist here at Neon. We provide a lot of dental services to our patients, so exams, x-rays, cleanings, fillings, extractions, dentures, partials, crowns, bridges. Pretty much we do it all. Root canals as well, everybody's favorite. The only thing we really don't do here is implants, but you know, they're not available in a lot of places anyway. And you know, once COVID goes away, we'll be doing a whole lot more, hopefully.
Yeah, how has the virus affected the dental services that we can provide?
Well, obviously dentistry is kind of uniquely positioned in that we create a lot of aerosols, so we're in a pretty dangerous position with a lot of what we do. So a lot of dental offices are still just providing emergency treatment only. There's some offices have gotten the PPE and the air purifiers and barriers up to be able to provide fillings and cleanings and things like that, but we're still waiting to get all of that together and get ourselves back up to full speed.
And in the meantime, we can still provide dentures and emergency care to help them with lifestyle.
Exactly, and we're trying to keep patients out of the emergency rooms with toothaches and things like that. And we do know some oral surgeons in the area that are working and taking out teeth in the meantime. So we're keeping people safe and healthy and at home as much as we can.
Thank you. Great. Thank you. Terry Turner, our tooth fairy, or our dental technician. He's going to explain some of the work that he does for Neon's dental patients.
And this right here is a actual person's mouth. As you can see here, when you take the teeth off, they have nothing. The ridge is strictly bone, so this is what the patient looks like without any teeth in their mouth. My job is to fill that space up, whereas they not only can smile, they can eat their food properly, but it has to go through several steps by the dentist. And then he brings it over here and we set the teeth. And if they like them and they're okay, we process it and finish it, and have a great day.
Do you also do partials? Or
Partial dentures, full dentures, whatever has to be done. Whatever needs to be done. If you got a hole in your face, we'll fill in that place.
We are now in our optometry department here at the Hough Health Center. We also have optometry services at our Southeast Health Center. Today we have Dr. Sapna Kumar, our optometrist, and David James, our optometric technician, and they're going to explain what they do here in optometry for our patients.
Hi, I'm Dave. Welcome to optometry. Come on in. this is where the patient starts, and I do the patient intake. I open up their chart and do the pre-testing for the doctor. Here, what I do is I'll do auto refraction for the patient to get a baseline, and I'll also do lensometry if they already wear glasses, so that the doctor knows what they've been wearing as opposed to what they should be wearing, so we know if there's any kind of drastic changes going on. After I do that, I do the visual acuity exam, which is the eye chart, so we can know where they're at with the glasses that they are wearing, or if they need to wear glasses. After I'm done with them, at that point, I enter the information in the computer for the doctor, and then I take the patient into the doctor's exam room, which is next door.
All right.
So at this point in the patient's appointment, I'll place the patient in the chair here and turn patient care over to Dr. Kumar.
Okay, and here at Neon, we provide comprehensive eye care to patients as young as 3 to 100 plus. We do comprehensive exams that include a refraction to assess their prescription. We do screening for glaucoma. We manage glaucoma, and we do a dilated fundus exam as well. So once the patient comes in, like Dave said, we have them have a seat, and we can do everything from our table right here. Once they're dilating, they will make their way to the optical, where they'll have a selection of eyewear.
Okay. So now after the patient's dilating and while waiting for that final exam, I have them look at the frames that they have a selection from, depending on the insurance that they have, or if they have no insurance. So we have a selection here on this desk here, which is for United Healthcare insurance. We have CareSource on the round rack here. They have a selection there, and they also, on the same rack, is Davis Vision and Gateway Insurance. Paramount Insurance is these ones, and these glasses here can also be paid for with cash if they don't have insurance. We have 2 different categories. We have these ones for $65 for basic glasses, and this one here, all of these glasses were donated to us by the manufacturers. They're either overstocked or out of style. And how this works is the patient will select this frame. I take this frame, send it to the lab, they make the lenses, and then send it back to me. And then I call the patient and say, hey, your glasses are here. And for this, it's $45.
Can you tell them a little bit about the Get Your Gear On program?
Oh, we also have a goggle program for students in school who play sports, so that they can still have eye protection, and if they have need corrected vision, they're a little rugged. They can withstand football, basketball, all that. And as for children who are 18 and under in school, we can get the patient's prescription, and we can get free goggles for the children.
Thank you.
Okay, you're welcome.
Okay, now we are entering our radiology department, and we have Faye Guyton, our X-ray mammography supervisor, who's going to take us through the different areas of X-ray. First, we'll go into general X-ray. We also have Panorex here for dental X-rays. You can't tell about the door, but the door is heavy because it is lead to protect the other areas. Okay, I'm going to let you talk about your passion.
So this is our general X-ray room. It's a Quantum QF series. This was installed in 2006. This table allows 500 pounds weight. As you can tell, it's swiveled, So,
and it does.
Yes, it does everything. So, we have the chessboard right here. And one of the features of the chessboard, we have this handle right here, where our elderly patient or a patient who are disabled with some disabilities are able to hold on and grip this handle without moving. Therefore, we don't need to repeat the exam.
What did we
This is
use
what-
before we had that?
Before we had that, we had an IV pull.
Not real sturdy.
Yes,
And Faye, with her negotiation skills, was able to get that included in the price.
exactly. Now, we're going over to our,
This is the best thing known to man and woman and babies. This is
our
called
Pegostat.
Pegostat.
And so when we're doing a baby chest x-ray, maybe if the child is 6 months and can sit up, this is what we put the child in. This helps the child to hold still but at the same time cry. And the reason for that is when a child cries, they and we try to get them as they're taking a breath. It's really quick, but we just want to imitate how a regular chest x-ray would look. So this is our Pegostat. This is the bigger size, and we have a smaller size down here. But it's just keep the baby, hold the baby together, and of course, make them cry. This is what we are. Now this quantum table, what would I say about this quantum table? This quantum table has really been, what would you say about it? Really been a blessing for us as a community health center. And because it was installed in 2006, it seems like it's old, but it's really not. We do PM on this table once a year to make sure everything is in working order. Now, if we would want to go to full field digital x-ray, this table is capable, this room is capable of doing that without buying a new equipment. So this is our CR unit. It's not full field digital yet. We haven't gotten that yet, but we still take the images. We have a cassette that goes into the reader, and the images pops up on the monitor, and we send the images to what we call a PACS, and from the PACS we send it electronically to the radiologist. Now, one of the beautiful things is we do the images, the providers who order the images are able to view the images on any device. They're given an ID number, username, and once they order the x-ray and the images, they're able to look at the images on any device, whether it's a computer or smartphone. So that's the beautiful thing about it. You don't have to wait for the report. You can just look at the images if you need to.
Yes. Okay, now we're going to go into our mammography suite. And since we don't have a large group, we can all fit in here. Usually we can't. This is not the norm that you would see at an FQHC, a mammography unit like this, but we are so grateful to have this because it really helps with our women and catching breast cancer very early.
Yeah, this is not full field. This is a CR still. Hopefully within the next year, we are looking forward to get to update to a 3D mammography. Now, this unit was installed in 2012. Again, it's not full field, so we do have cassette. We do have a reader right here. And of course, we do have the monitor. Once the image is taken, we put it in the reader, it goes on the monitor, and again, we're able to send it to the PACS for the radiologist to view. And as you know, every 3 years we have to be accredited. So every 3 years we go through the process from the federal government, send our images and make sure everything is good for accreditation. And that's really a very tense, difficult time.
And I can vouch for that because I am not allowed to call or email or ask for anything during that time.
In that period of time.
Yes.
But we are proud of what we have.
Yes.
We, you know, most FQHC do not have that.
Can you show them some of the different
Oh
paddles
yeah.
and
So
the other things you
this is one of the
negotiated?
paddles right here. This is another one. So there's two sizes, large and small, but they're just different paddles. depending on the type of breast the patient has, this is one of the paddles that we use. If they have elongated breasts, this helps to make sure the compression is even and uniform.
Where's the little one? We do men, we do.
Oh, yes.
Yes,
We do men. I forgot about that. This is the paddle that we use for men and women who are extremely small.
And then can you show them your little gadget for helping to smooth out?
Thank you so much. Vicki, you're remembering a lot. So, a spatula. So if we have any creases or anything when we compress that needs to be smoothed out, this is such a good tool and a good helper for us. So we have it in here all the time. Because you don't want creases in a mammography film. The radiologist does not like that. You could lose information. So this tool helps.
And Faye also negotiated
Yes,
this nice.
Well, yes, I sure did negotiate that right.
Because you don't want them just laying
Right,
on
to
the
keep
table.
what the word I'm using, so that there's no cracks. So that's why we have that lined up.
So if you ever need to put on an estate sale or yard sale, Faye
I'm the
one.
Yes, I like to negotiate.
She negotiates for us. Thank you,
So-
Faye. This has really been helpful. And how about how women can pay for it, how they can get
Another
it?
thing, so there's no barriers for women getting a mammogram. We have a program called the Breast Cervical Cancer Project, and they take women starting from age 26. If they have a strong family history, they are able to pay for the mammogram. Then we also have women who are underinsured, or even women who have insurance, but perhaps their insurance doesn't pay for the mammogram. They can also participate in the program, and it's free. The program not only pays for your screening mammogram, but if you need a breast ultrasound, a biopsy, the program will follow you outside of Neon and pay for everything that you need. There's no barrier, no reason for a woman not to have the mammogram done.
Thank you. Okay, we have our new ultrasonographer, and her name is Sarah Dorsey, and she's going to tell you a little bit about what she does with her new high-tech machine called a Bolson machine.
Hi, I'm Sarah. The ultrasound machine uses sound waves to look at soft tissues and organs, and right now we do pelvic ultrasounds, limited OB, and breast ultrasounds for our patients. But we're trying to expand to do abdomen, DVT studies, and pediatric patients as well.
Thank
So
you.
how far along in a pregnancy will you be able to do OB?
Well, we usually just do first trimester.
Okay, and then that is sent to our radiologist, right?
Right.
Excellent. The same as our other x-rays.
Great.
And mammograms. Great. Thank you. To meet now our Director of Behavioral Health, Dr. Erica Staniff, and she's going to talk a little bit about their services and integrated care.
Hi, I'm Dr. Staniff. I'm the clinical psychologist here, and I run the department for behavioral health. Some of the services that we're providing currently include, more traditional mental health counseling with chronic mental health issues, as well as more acute mental health concerns. We're also identifying other types of mental health issues that are comorbid with medical concerns, so such as anxiety with high blood pressure or diabetes, and how those factors are implicated in those types of diagnoses. Additionally, we are, and in addition to that, we're doing more integrated care. So we're trying to get people the service of like an education around the mind-body connection through the medical visit that they have. So our services are becoming a lot more integrated with time and with additional providers, such as the wonderful Dr. Kathleen Alto. We also are running an MAT program, which is one of our integrated clinics. Medication-assisted treatment, MAT, is the use of medications such as Suboxone, buprenorphine, with Vivitrol or naltrexone, in order to manage the addiction, the withdrawal symptoms of opiate use disorders. We pair that medication management practice with ongoing counseling that's focused on addiction and substance use disorders. Patients work with our counselors on a weekly basis, or further out as they develop some consistency in our program. And they also have paired visits with a medical provider to manage those meds. So that is behavioral health in a nutshell, and we're constantly looking at adding additional specialty clinics for further integration.
And who has access to the behavioral health services here?
So behavioral health services can be self-referred from outside of Neon, but we also, as I mentioned, are screening our existing patients to make sure that they get linkage to our services as well. So it's probably a bit more targeted, at existing Neon patients, but it's available to outside self-referral.
Thank you.
Thank you.
Oh, there she is. Surprise.
Hi.
This is Brittany Cermak, and this is our very first virtual health center tour with the CASE first-year medical students.
Hi, everyone. Are they on live? Oh, they will be. Okay. Anyway, sorry. I just want you guys to know. Yeah. So,
Tell them a little bit
nutrition.
about what you do with our patients.
Yeah, so nutrition is obviously super important, especially now with dealing with the pandemic, and just our immune system is extremely critical to us preventing from getting sick. And the best way to boost your immune system is not necessarily all the supplements that say out there that can boost your immune system, but it's seriously what comes from the earth, your fruits and your vegetables for sure. Getting in those healthy fats like the omega-3s, coming from olive oil, nuts, seeds, things like that. But anyway, here at Neon, I work with any patient that is in need of nutrition help, which is literally everyone, right? Because everyone can afford to improve their nutrition in some way or just learn more about it. So oftentimes I'll get referrals from doctors, whether it be the pediatrician, adult medicine, or from OBGYN, and even behavioral health. Whenever the patient may need it based on their blood work needing to be improved, or the patient may not want to get on another medication that they're being threatened with. I work with the patients to, figure out where they're at, what their goals are, and figure out what nutrition aspects we need to adjust in order for them to get to their goals. So right now I'm just doing telehealth, as is everyone, right? So I'm sending our patients the information in the mail that I would normally discuss with them in person in the office. And the great thing about nutrition is that everything can be virtual right now, which is great. And so I do like to do more nutrition coaching in a sense where we're touching base more often, as opposed to a traditional dietitian setting where they may come in 3-6 times a year, something like that, and it's just not really sustainable and helpful with them creating changes, because we know that coaching and that ongoing help and support is really what they need. So Neon is awesome, and part of the HRSA grant is allowing them to come to see nutrition for free. They never have to pay a copay, it doesn't have to be along with their insurance plan, and so that I really get to help them along their way with their health journey. So I love helping with that. And we are supported by our food distributions, which are drive-through style right now, which is great. So whenever I'm encouraging our patients to eat more fruits and vegetables, which they should be doing, I always have a list of different resources that they can go to, because so many of our local pantries are giving away boxes of produce, as well as here at Neon. So that is what I do. I love helping our patients learn how to eat healthier and figure out small modifications they can make in their life in order to lead a healthier life. So
Thank you. Thank you very much.
you're so welcome.
All right.
Good luck at school. Also, I teach at Case Western, so if you ever see me on campus, don't be afraid to say hi. My name is Brittany Cermak.
Thank you. Alan, our security guard here at Hough, also our cat uncle. He is the uncle of one of my cats. So Bobby can tell you a little bit about the security he provides here.
Well, I'm one of the few that get here real early. I get here around 6 o'clock and start opening up the building for the day. And if anything happened before then, we know about it. We have a chance to take care of it before anything else happens. And I love working with people, so it's a perfect job for me. That's the new people.
Yes.
Yes. Okay.
Thank you, Bobby.
You're welcome, Vicki.
Us outside, and we are with Shaquita Yarbrough, who is the coordinator of our Moms and Babies First program. But today they have a special event, a food distribution, and she's going to tell you a little bit about that.
Yes. Good afternoon. I'm Shaquita Yarbrough again with Moms and Babies First. And what we do, we have a food distribution. It's a drive-through distribution because we want to make sure that we're keeping everyone safe due to COVID concerns. However, we have some healthy fruits and vegetables and produce, as well as some dairy products. We're over here at 8300 Hough, and this is our second distribution. However, we have historically had a food distribution site at all of our different sites, and we will be continuing that shortly. Also, what we're trying to do essentially is address infant mortality in a holistic way. We're addressing the family, not just the moms, the dads, the grandmothers, as well as not just their mental health, but also their physical health and wellness. So addressing nutrition needs and things of that nature. Often we don't understand how people have limited access to great fruits and vegetables. So here at Neon Health Services, we're trying to make sure that we're helping people in every which way possible. Thank you.
Thank you.
Well, thank you so much for coming on our new virtual tour of the Hough Health Center. We were so happy to have you here. Things aren't the way they used to be, but I think this gave you an opportunity to see how we've adapted and met the needs of our patients. So now I think we're going to turn over for some questions, and I'll do the best I can in answering those for you. Thanks again.